Hi, I'm Professor Bill Pinsky. I'm the head of the Oxner Clinical School with University of Queensland. I'm going to have a conversation with you and answer questions that I frequently hear from students who are applying for our program. The question that is on everybody's mind is, how do our students perform on the USMLE exam? Clearly, to practice in the United States, students must pass the USMLE. And just as important, doing well in the USMLE is very important for obtaining a residency program in the United States. When we started the program, it became very apparent to us early on that although the curriculum at University of Queensland is very similar and comparable to the U.S. Curriculum, the way it is taught is a little bit different. Having been in the dean's office at Wayne State University Medical School in Detroit previously, I recognize that the teaching of the science classes is really oriented to the students taking the USMLE exam. Because the majority of the students in Australia are not taking the USMLE, the courses are taught differently. Because of that, we've instituted a pretty robust tutoring program to assist our Oxner UQ students for Step 1 USMLE. The assistance includes tutoring classes, some that are taught by the students themselves, including more senior students. Some are taught by faculty. We also provide a question bank for students so that they can do their own preparation by practicing taking test questions. And then we also require the students to take practice exams. These are exams that USMLE prepares for students to take prior to sitting for the real exam. Initially, we had this as a voluntary process to take the exams. Now we require the students to do this, and we pay for that. There is a correlation on performance in the practice exams with the actual exam itself. So it's a pretty good gauge for students to know how they're progressing and what areas they should concentrate. The result of all of this extra preparation is that our students are doing well on Step 1. They're performing just about at the average for the U.S. medical student. Step 2, which is taken in the last year of medical school, and covers the clinical sciences. We really do not have a special tutoring or preparation package for the students. And the reason we don't is that spending the 3rd and 4th years at Oxner, where we're teaching along the lines of U.S. medicine, the students really get quite a bit of clinical experience in teaching. Also, because of the academic year beginning in January for our students at UQ, our students actually have probably about a 6 months head start on the clinical areas compared to the U.S. students. So we've had 2 classes now take Step 2 of the USMLE. And so far, the students are doing exceedingly well, averaging approximately 20 points higher. So our students' average scores are about 20 points higher than the average student at a U.S. medical school. It's really not a big surprise to us. I think the foundations that are taught in Brisbane and then the clinical work that's taught in New Orleans is a caliber that really prepares the students very well for this. I always tell students at orientation at the beginning of their matriculation in Brisbane that their job is to do well in school, so do well in their classes, and to start studying for USMLE right away. The Australian students really are just concentrating on what I would call the regular testing that's part of the curriculum. But the U.S. students, our Oxner students, have an added responsibility and need to really start preparing as soon as they start medical school. Another question I frequently am asked is about residency matching. Clearly, getting into medical school is a competitive endeavor, and matching into a residency program is also very competitive. And to be able to practice in the United States, in addition to being successful with USMLE, one has to do a residency in the United States as well. You know, there is probably a little extra hurdle for students who have a degree from an institution outside the United States in terms of matching and residency. But again, it gets back to doing well in medical school and doing well in the USMLE exam. So right now, we've had one class graduate, and we have our second class just in their final stages of year 4, and actually are beginning to interview for their matching. Our experience on our first class was that all of our students matched within their first 3 choices, which was very gratifying to us. Now, that was a small class, and each class is subsequently getting bigger, and so there's probably more challenges out there. But I really believe that if the students do well in their classes, do well with their USMLE, and then are able to distinguish themselves in other areas to separate themselves from what I always say is the other smart students who are finishing medical school, they should be successful. So a couple things that we do to help in being successful with the match is we do a boot camp. We do a residency matching boot camp where we talk to the students entering their 4th year about all the details of the timelines of, you know, when you have to get your applications in, how you look at programs, that sort of thing. And then we also make available our own program directors in all the specialties so that they can do what I call speed dating type activity, where they have the opportunity to meet or interact with as many programs as they like. And during the year, we do mock interviews. So some of our program directors or some of our faculty who are on the selection committees for our residencies do mock interviews with the students so they can get used to what it's like to go in for the interviews and can learn from, you know, some do's and don'ts and things to help them. The other thing is that in terms of helping our students distinguish themselves is that we now have embedded into our curriculum coursework on patient safety and quality. And there's an organization that we refer to as IHI, which is Institute for Healthcare Improvement. And they have an online course where students can get certified in patient safety and quality. For all of us who are involved in academics, all of us who are involved in patient care, patient safety and quality is foremost in our minds. And so if we can have our students demonstrate that they have special expertise in patient safety and quality, when they go for their interviews and in their application process be able to demonstrate this, I think that will also get the attention of those who are reviewing for residency selection as to whom they're going to invite for interviews. Another question I get is why are we in this partnership? You know, why has Oxner entered into this? Why has University of Queensland entered into this? What is distinguishable about this partnership in this medical school compared to U.S. schools and compared to other international schools? So let me answer that by talking a little bit about UQ, and then I'll talk a little bit about Oxner. University of Queensland for many years has been one of the most highly ranked universities in the world. There are various surveys, rating agencies that rank universities around the world. And University of Queensland has been pretty consistently anywhere from top 25 to top 75 in the world, of the thousands of universities out there. Now, I recognize that some of these surveys are a little bit like beauty contests, but they look at some very important metrics, including quality of the students, quality of the faculty, research, publications, those kinds of things. And University of Queensland is known as a research university. They average about $400 million of extramural support annually, which really is quite a bit. A lot of innovative research and technology has come out of University of Queensland through their research. For example, the Gardasil immunization, which is the immunization to prevent HPV, human papillovirus infections, was developed by Ian Fraser at University of Queensland and then jointly marketed with Merck. Also, the CT technology, the computerized tomography technology, which is ubiquitous in our healthcare institutions, the software for that is used, I think, by virtually every manufacturer in the world was developed at University of Queensland. And so these are just two that I would bring out with that. Additionally, the graduates of University of Queensland are known to be good physicians, which means the educational process is very, very strong. So partnering with a university of this caliber is something that we were looking for from Oxford, because it's not just the educational partnership that we've been interested in, but it's also the research partnership as well. And why is University of Queensland with the Oxner Health System? Oxner is one of the best known independent academic medical centers in the United States. We've been doing medical student teaching since our inception, really, in the mid-1940s. We're a major teaching site, have been a major teaching site for both Tulane University as well as LSU. Our faculty are experienced in teaching. They're dedicated to it, and it's an important part of what we do. Additionally, Oxner is known for patient outcomes. Over the last several years, we've consistently been ranked in the top 15 of all teaching hospitals in regards to patient outcomes. U.S. News and World Report that ranks hospitals among, I think it's 12 different specialties, has had Oxner ranked in the top 50 in 11 of those specialties over the last few years. And this is an indication of how well we take care of patients and what our outcomes are. And the reason that we at Oxner have wanted to have what I would call our own medical students versus just having transient students from the two local medical schools come through periodically is that we really believe that our integrated academic healthcare system is the right kind of model to give the best care to our patients. We've had a computerized electronic health record for many years, and if we could embed students for their clinical years, the third and fourth year, in our clinical operations, not only can we teach them all the essential points of surgery, pediatrics, etc., but we can also have them learn what the best way is to take care of patients. And that's important because our big commitment is to the community, the community at large, that we're going to take care of them as well as possible, and that we're committed to train the next generation of providers to be able to give the same type of quality. And we know we can make better physicians if we have students embedded with us for a consistent period of time. Another question that comes up in regards to helping to be successful for matching is how much is known about this unique partnership between Oxner and UQ among the residency teaching programs around the United States? And I think that's a fair question because it's a new program. So I can address that in a couple different ways. We are working very hard to get the word out, as you can imagine. I've been very fortunate during my academic career to be really pretty well connected at the national level through the AAMC, which is the Association of American Medical Colleges, and also through the ACGME. Now you may know that the ACGME, which is the Accreditation Council for Graduate Medical Education, is the accrediting body for the 9,000 plus residencies in the United States. And I've been on the board of the ACGME for the last 3 years, and I have another 3 years to go for my final term. And so being on the ACGME board, not only am I apprised of changes in residency programs and requirements and that sort of thing, my fellow board members, the other 18 or 19 board members, are deans of medical schools, CEOs of health systems, pretty prominent people. And I can tell you they all know about our program. We talk about it frequently. And they are all interested in whether our graduates would be interested in applying at their program. So I think that helps quite a bit in getting the word out. Also, when the applications are being loaded into the computers for the matching, we do what's called a dean's letter. This is standard at every medical school in the United States. And so we spend some time with each student being sure we have all particular information about their unique features. And I write a letter, or our office puts together a letter for me that includes background information about the program and why this is a unique program, and the fact that the students get to really the best of sort of two possible worlds of being educated and trained in two different continents with not two terribly different ways of practicing medicine, but some differences, as well as exposure to students from other parts of the world, and a top clinical healthcare institution in this country as well. The letters, so we've had one class that has graduated at this point, and I think those letters had to be effective because our students did very well in matching, and now we're entering the match season for this year's class as well. The other point I think that helps the students prepare to be successful as residents is the fact that we have our own residency programs. We have 27 different GME programs at Oxnard with over 300 and I think it's now up to 40 house staff at Oxnard. And the students, on the teaching teams, on the clinical teams in the hospital, there's attending physician, then there's senior residents, junior residents, and medical students. So our students spend a lot of time interacting with our house staff. So they really learn the particulars of how the residency programs work, what they need to know. And I think that's also going to help them in their interviews as they're competing for positions. And that might help differentiate them, not so much from the U.S. graduates, but maybe graduates from other programs that might be from outside the United States.